Hi, I'm Adam Seat, and I'm the lead pastor at Orange United Methodist.
And I'm Corey Robbins. I'm the associate minister here at Orange.
And today we are thankful that you are watching this episode of Table Talks with us. Today we have some very, very special guests with us. We have with us Dr. Thomas Belhorn, who is the director of Infectious Disease Fellowship and a professor of Pediatrics at UNC School of Medicine.
And we also have Dr. Dana Martin, who is not only a nurse herself, but is also a doctor of nursing practice and is the associate professor of nursing at Pfeiffer University, as well as the director of the Clergy Health Institute there.
Yeah, so thank you so much, Dr. Belhorn and Dr. Martin. Dr. Belhorn actually is also a member at Orange United Methodist Church, and so I give thanks to call him a friend in that way. And so thank you for being a part of this, Dr. Belhorn.
Thank you. And Dr. Martin and I have worked together for several years with the Clergy Health Institute, and Dana is a member of, you'll have to remind me of your church's name.
I'm a member of Matthews at First Baptist Matthews near Charlotte, North Carolina.
Great. Well, thank you all so much. This is such a remarkable time that we're living in, and I am certain that probably a lot of people are almost sick of hearing about COVID-19, but there's still so much information. It seems that we hear in the news one day one thing, and then we may hear something contradicting it almost the next. And so we just thought it'd be good for people of faith to be able to just share some information and what we know. And so, Dr. Belhorn, I'll just start with you. Can you tell us a little bit about the science of the virus and how it's transmitted and how you know if you've been infected?
Sure. First of all, I feel a little peculiar. You guys calling me Dr. Belhorn. I'm Tom is fine, but that's okay. Definitely, and just to make sure everyone has a baseline, coronaviruses have been actually around for a long time, for centuries. There's many in animal species. There's actually 4 different types of what we call endemic coronaviruses that we have known about for years, and we don't talk about them because they just usually give us cold symptoms. But starting in 2002, 2003, we had the first of 3 of the what we call bad coronaviruses or epidemic one. SARS was the very first one, and luckily that only lasted for a couple years. And then MERS-CoV came around between, or several years later, and now this one is it's sometimes called SARS-CoV-2 because it's very much like the original SARS virus. People quickly say, well, why did that one go away and this one seems to be causing such of a pandemic? Has many reasons, but part of it is that the original SARS, if there was anything good about it, it was transmitted to others really when you were very sick with it after a few days, versus this virus that unfortunately, once it can even be transmitted even before you're getting sick, sort of like flu, chickenpox, things like that. But it's transmitted mostly by cough. So like if someone had COVID or SARS-CoV-2 and had early an infection and was coughing at me, I could be infected with that. It can stay on surfaces, especially longer period on plastic or plastic steel, things like that. So if I touch surfaces like that and then touch my eyes, my face, it can be transmitted in that way. The timeline is if someone infected me today, I would be fine for several days at least. And then I would have the onset of symptoms usually around day 5, 6 or so. And I would have virus that has starting to replicate in my nose, in my upper respiratory tract, but also occasionally down in my lung. It really progresses down lower. There's a truckload of virus at the time, especially, and if I start coughing, it can easily be transmitted to other people. There's a wide range of symptoms, though. We are finding out now that a lot of people have no symptoms whatsoever, which is great, although we worry about children because children are more likely to have very mild disease and have no symptoms whatsoever. But then if they run up and give you a hug, it's possible that that could be transmitted to you just in that manner. It's usually, again, though, by someone that is coughing. Some people have a mild illness that only lasts a few days. Some people have more severe illness. It seems like the high-risk population, and I know you've heard this on the news, are the older you are. It keeps saying age 65 and older. So I'm a few years away from that. It now has me worried what happens that midnight on my 65th birthday that makes me at risk of this. I don't think there's anything magic, but the older you are, but then what they call comorbidities, diabetes, hypertension, and there's a variety of other factors that make you more at risk to having very severe disease with this.
Wow. Yeah. I think we've heard a lot of that, but that is helpful information. I mean, I think having the historical context of where this comes, that this is not something, well, it is a new disease, but it's from a series of others.
Right.
Yeah.
And I'd just like to add, I had a lot of the same notes that he had as well. I heard a holistic physician speak last week, and it was interesting how she worded it. She said, you get the virus through your mouth, your nose, touching your face, your mouth, your nose, your eyes. So keeping that in mind when you're out, if you have to go out into the public, to the grocery stores, to the pharmacy, that kind of thing, not touching your face is very, very important. And he talked about some of the at-risk, again, the age being part of that. So 65 and older, those with heart disease, those with what we call immunocompromised situations. So if it's a patient who maybe is on a chemotherapy drug or other types of drugs that can decrease the immune system. The big thing is if you have diseases like diabetes and hypertension, it's extremely important to try to keep those under control. So trying to keep your blood sugar levels under control, trying to keep your blood pressure under control. So cutting out a lot of that salt, trying to decrease your stress, not a lot of caffeine, those things that you've likely been taught to decrease your, or hopefully have been taught to decrease your blood pressure. And then of course, not eating the sweets and all those carbs that we tend to go to when we are quarantined to our house, if you're diabetic. So I just wanted to kind of add those things in as well.
Right.
Well, that's really, really helpful. And you mentioned that a lot of folks who have the disease or, have been exposed to it don't show any symptoms, or that is surprising. I don't think I'd heard 6 or 7 days even in. So does that mean, should we all be tested, or just because we could be carriers, or what are your recommendations or your thoughts about that?
I'll let Dana add her thoughts about this too. We all wish we had plenty of testing so that we could test everybody, because we really would like to know who all is infected and asymptomatic, because then we know, number one, that they hopefully will get immunity from this. But it's not really clear that those that are asymptomatic, they certainly may be infecting others, especially younger children or adults with this. The slight problem with the tests, number one, we don't have enough. The main tests that are in use now are all looking for the virus. And so you usually are doing that nasopharyngeal test, swab, which isn't fun to get, but then they test it. It depends on which test is used as far as how fast it comes back. Again, we have a limited number of supplies. There's a variety of ones. I know we have a very recent new saliva test with this, and there are a variety of other tests with this. That's most effective soon after you get symptoms. And so if you have just been symptomatic for a few days, you're coughing, various things, and pretty early, and you get a good swab, that's an excellent test. It will pick up the disease. I got a call yesterday from someone, though, that said, well, they had been in isolation 14 days and wanted to check to see if they had it, so they were going to try to arrange a test. And I said, That's not the best way to do this, because you start getting much less virus the more days that you have had this. And so that's where the other type of tests that we talk about, serology or looking for antibody, comes into play. There's several of these that are just now coming on the market. Here at UNC, we're looking at several of these to make sure that they are good tests, because there have been some not so good tests used in the past. You have to remember, though, that if I'm infected today and I get symptoms, it's going to be 5 to 7 days usually after I get the symptoms of this that my antibodies will start being positive. So it's a better test to say in retrospect, yes, I did have this perhaps late in my illness or so. It might be a good test with these. So we'll eventually be using both of these tests, but the problem is we just don't have enough of either one right now.
Wow.
You can give your thoughts.
The consensus here is the same as well. So only those who really have or develop symptoms at this point are being tested. Hopefully in the future, if we have more tests available, will change. But for now, we are just testing those people who develop symptoms.
Wow. Well, what are some of the things, I know you've referenced about not touching our face and things like that and being very cautious with that, but what are some of the other things that we can do during this time? Is the social distancing, the stay-at-home orders that we've been trying to abide by, is that flattening the curve? Is that helping things? That's one of the questions that actually came in from one of our church members through Facebook about flattening the curve. That was from Beth Summers, so we're thankful for that contribution.
Dana, do you want to go first?
I can certainly go first. From what I understand, we are starting to see a flattening of the curve. It's going to take some time, though, to see it flatten out. So it's not something we'll know even in a couple days, but it will take some time to know that for sure. What they term social distancing, what I prefer to term, and I'm hearing more commonly now, is physical distancing, because we don't want to not socialize with other people. And we want to physically be away from them. So that is helping and will continue to help, even though it, has been a burden with some, situations with businesses and that kind of thing. That's the only way we're really going to see a positive impact on the curve. We've mentioned avoid touching your face, avoid touching your eyes, your nose, your mouth. And I don't think I really realized how difficult that was until this happened. And then you realize how much you touch your face. Avoiding close contact with other people that are not part of your family, especially if they are sick or coughing. You don't want to be around them. Covering your mouth and your nose if you cough or sneeze, covering it and with a tissue if you're able to, and then not reusing that tissue, throwing it away, washing your hands really good afterwards. Clean and disinfect surface areas that are touched a lot. So doorknobs, remote controls, cabinets, that kind of stuff. Light switches, your toilets, your sinks, maybe your chairs that you sit in a lot, for example. Not going into crowds unless necessary. I know we all need to go get groceries every once in a while. So trying to be, use that physical distancing when you do have to be around other people. Some other ones, just not smoking or vaping. We know through some of the research we've seen that smoking is one of those things that puts you at risk. So not, quitting that if you're able to, making sure you keep your blood pressure, diabetes under control, taking your medications and supplements as prescribed by your primary care provider, and then increasing your immune system. So plenty of sleep, exercising while practicing physical distancing, healthy diets, limiting alcohol, managing your stress. We know that stress causes you to be immunocompromised to a degree. So those are just some of the things that I had kind of made notes of.
Yeah, well, I've never wanted to scratch my eye so much as hearing you say, don't touch your eyes. So, Tom had written a beautiful devotional for the church during the season of Lent, and he used that same language that you did about not stop social distancing and to practice physical distancing, but to be social. And so, Tom, thank you so much for that word, and what a great reminder.
Sure. Thanks. In total agreement with everything Dana said. I often have patients asking me why the eyes, and to some folks it's not quite as clear, but I'd say, remember when you get watery eyes or cry, you get a runny nose, and that says that whenever you get anything in your eye, your tears turn away, and basically it goes right down to your nose. And so we don't realize how many times virus infections are transmitted that way. So it's important. But exactly as Adam said, you know, when you're having to wear your mask for hours or so, and it gets uncomfortable, and you're really not supposed to be touching your mask and your eyes, and it is something that you have to remember. I think the other thing we've run into that with some of the COVID patients here at UNC or COVID rule-outs is if they are discharged or you have someone at home. I joke with my wife that if I get COVID, that I'm banishing myself to the basement so that she doesn't, we're going to be separated. Hopefully she'll remember to leave me a plate of food on the top stairs or so once occasionally. But it's important that if you have someone that's COVID positive, to have them in a separate part of the house. And that's tough, and especially if it's a child or someone, I mean, that is, you have to just use all the precautions you can. Strict hand washing, you know, trying not to touch your face, your eyes, things like that. And then I'm a pediatrician, and if you have a 2-year-old at home, hygiene is often a foreign concept to teach to them, and that is really tough. But you just need to do the best you can as far as now's a good time to teach hand washing, but realize that that's going to be a challenge with this if you have young children, so, or older children.
Well,
Pastor Corey.
Yeah, I will. It is so cute. Now we've taught Ephraim, he uses doxology as his lullaby, but that's also what we use for hand washing. So every time he starts washing or using hand sanitizer, he sings the doxology. So he's learning.
Good.
I would also like to add, if it's okay, just this seems very basic, but with hand washing, again, at least 20 seconds. But we do hand washing with our nursing students, like at the beginning of nursing school. And one of the things we do is we use fake germs and we put it on their hands, and then we let them wash their hands how they think they're supposed to wash their hands, and then look to see if they got the germs off. And most of the time they miss around the fingernails, between the fingers and the backs of the hand. So just kind of a note to when you are washing your hands, you want to do it effectively. So you want to make sure you get those areas really good.
Right.
Thank you. Well, our next question, I have great respect for the fact that we are located in Chapel Hill, and so we have a lot of medical and healthcare workers in our congregation. So they did not have a learning curve when they heard these 3 letters, but I did, and I felt like I didn't know something I was supposed to. We've heard so much about PPE. And I won't steal anyone's thunder, I'll let you answer, but what would you recommend for PPE for the general population initially?
So I think now we've been instructed that everyone should be wearing a mask, and I brought my props here. This is an Alice Fennell special that she made for me. I know Jean Hall and others have made these, but Alice, this is my favorite with this. Cloth ones are the ones that we all are able to use. I cannot use it here in the hospital, but coming to and from the hospital, if you're going to the grocery, and we're really supposed to wear these. And Dana can comment on this too, but we're all taught that really this is most effective at preventing, if I am early symptoms or have some cough, from preventing me from spreading it to others. It may have some benefit in me becoming less infected with this, but I think it's more for that benefit. So we're really all supposed to be wearing that type of a mask. Now we have the other medical ones, and I have two of mine here, and notice I'm holding it on here. So I'm allowed a mask, and since I'm both outpatient and urgent care, as well as here in the hospital and ICU, I have one for each. This is supposed to last me 5 days. So I'm on shift 3 of this. These are nice that some people, if you have this available, it is a approved mask that is supposed to be a little bit better. It's well designed with this. The problem is it does get used, and you're supposed to throw it away after that period of time. And then the N95 mask, which I don't have here, but we have over in the hospital, that I have to wear if I'm walking into a patient that has COVID or COVID rule out. Those are the ones that are the best to use, and that's the ones that are fitted. If you're a healthcare provider, I'm sure probably Dana's had to have her fit testing with this also. I do not like them actually, because they're very tight on you and usually makes a mark on me, but it is the best to use as far as preventing certain types of infections. But really the cloth masks are what we use outside of the hospital. Gloves you can use in certain situations. I always give a warning, and Dana can also chime in. I had a mother of a patient that I just spoke with yesterday that said she was still doing her time at a food bank and handing out things, but she said, I wore gloves the whole day. Be careful, because gloves, like your hand, can become infected. And often people are not washing their gloves. And so if you do the same things, touch your eye with this, that is still infecting yourself. So just be careful with that. Other situations, certainly here in the hospital, gown, the face shield or so, if I'm walking into the PICU or so with one, a COVID patient, that usually that's not outpatient. There's always a debate if your spouse or someone in your household does have COVID, you do the best you can, but masks certainly, and just hand washing the things that we talked about before.
And I totally agree. For the masks, so use a mask if it's cloth or type of material it is. Always be very careful when you're taking it off.
Yes.
Because you can put your hand to your eyes or your nose or your mouth and contaminate yourself that way. So just, be very careful in your actions as you take them off. And if you have medical type mask that he was talking about, the N95, other mask that he showed, you can always do that to healthcare workers, which is just huge and ideal, because we just don't have, when we're having to use a mask or that kind of thing, it's just not an ideal situation. So consider donating if you have.
That's a beautiful word, because I know, Tom, when you said that you were given that mask to wear for 5 days, that is frightening.
Yeah.
To think about. Wow. One question that I know that we've even had at my house is when we've received a delivery from like Amazon, should we wipe down or treat the box? Or what about our groceries? How should we go about those kind of things that are coming from an external place into the safety of our own home?
I may let Dana go first, and then I'll give a
Okay.
thoughts. I'll let her speak first.
Okay. So we know that if the virus on a surface, it can sit there for what type of surface it is, anywhere from hours to days. So does it hurt to wipe down the stuff that you get from Amazon and grocery? Not at all. I am practicing, and Tom may have a view of that, but I'm wiping down our groceries and that we get from Amazon and that sort of in the house. We kind of house and we don't get in until it's wiped down. So
Right.
I think we're hearing it in the media all the time, and I know there have been some reports about that. But I think, I just don't want people to go over and above for things. I think, again, the main transmission is respiratory, someone that's there in front of you coughing at you, or surfaces around there. And I think high touch areas in your household, I think it is fine. I think people need to recognize, which I forget if I mentioned before, but like if I am exposed, but it's on my clothing or on my scrubs, that usually is not that much. If it's on cardboard, it can last up to a day. For some of the plastic or other surfaces, as long as 3 days. So I think I heard someone mention just, if you have a milk container or things like this, or with the box. But to keep in mind also, you can just wash your hands very well, after you've unpacked things. That should be fine too. Wow. I think it's fine, but you don't have to go too far overboard. Think of where the main transmission is. So.
Right. Well, this is a very busy time for a lot of people. Some people, this is a time that they're have a lot more time on their hands, but I know that the two of you are very busy people, and we've got just a few more quick questions we wanted to run past you for the next just a few minutes.
Sure.
Well, I would say, how can we support you all in the work that you're doing? How can churches, how can individuals, support healthcare professionals? We know that, like Adam said, you are busy, you are in high demand. So any suggestions or recommendations?
Danny, you can go first.
I would just, as a instance for activity.
I think we're having a little bandwidth issues. So that was sort of cutting out. I don't know if everybody was able to hear, but Tom, how about you share?
Well, I think for healthcare providers, there's a wide spectrum. I have some good colleagues and friends who are in private practice, and actually their practice closed, unfortunately. And so they're having financial issues, and one of them had been communicating with me and is really feeling guilty. They can't really help out during this crisis. I think others have really more issues of having to switch to virtual care, which is new to many people, and trying to switch to the videos, to phone, and really not seeing people in person. If you're hospital-based, I think it's, usually this is a stressful time, I think, for everyone. There are some people that have had to be laid off. I think it's just stress, not knowing exactly. Hopefully planning has been good enough that we won't have a big surge, and we will have enough ICU beds, things with this. We have plans like Pediatrics is changing. We're going up to probably age 30 at least or so to help out with the adult services. And the term redeployment has a lot of people stressed in that they say you're no longer just a specific PEDS ID doctor, but everyone is a provider, and that you could be pulled if everyone's exposed in the emergency room or something. I may have to spend time in the emergency room or other places. And so that has a lot of people just concerned. But prayer, as always, always nice to get, just not things, but cards, emails, I know, are always appreciated, things like that. Children, or my colleagues that have young children, it's a stress right now, especially, and anything you can do to help out with them, with planning for childcare, fun things in the neighborhood that their children could participate in, things like that.
Yeah. I thought it was really neat that I saw today that one of my best friends is a police chief in a small town in eastern North Carolina, and last night several police departments and fire departments went to the local hospital and had the fire trucks with ladders extended, lights flashing during the shift change, and just people out holding hands, thanking our heroes that are on the front lines.
Holding signs at them, not hands.
I was going to say, I don't think it's good to hold hands with.
No, not holding hands. Yes, holding signs. Thank you.
Okay, that's better.
Yeah, but it was just a neat way of just expressing gratitude and thanks for what all the people that are helping share information, helping to inform the public of what's going on, because frankly, we really don't have any idea how long this may go on. It's really a moving target, isn't it?
Correct.
So,
yep.
I've heard there have been some times that we've tried to make guesses, and I think the reality is we have to take this one day at a time and anticipate that this is a marathon, and we have to run it 1 mile at a time, and ultimately we will be seen through this, but we have to demonstrate the patience. We can't get there in mile 1, and in some ways it still feels like we're in the very first parts of this race.
Right. As Dana said, we are flattening the curve, and which is great, because if we do that successfully, we're not going to be overrun at the hospital. But the problem is there has to be discussions of the economy. When is it actually safe to start getting some people out of isolation? And that's a tough one, because we're still rising here in North Carolina, especially Orange County. We've had a lot of admissions already now from the nursing homes, assisted living, and so we're starting to see the brunt of that. So.
Right. Well, real quick in closing, is there a good resource that you could point people to go and find really some of the best information to stay up to date and to stay informed?
I'll let Dana see if we...
Okay, I'll tell you some of the places that I use: the North Carolina Department of Health and Human Services, as well as the CDC. Johns Hopkins has a great, although it can be scary, map that shows the world and the United States and how many cases we have. And I think sometimes when you look at that, realize these are places where you see higher numbers a lot, where we have more testing that's going on. So keep that in mind if you do look at that. But I also use the American Public Health Association as well.
What was that last one more time? American Public Health?
Public Health Association, American Public Health Association. And then, of course, as a nurse, the American Nurses Association as well.
I would say CDC is one of the best sources that stays up to date, and they have information for healthcare providers, for families, and they really cover the whole gamut of things. And I will offer, I think many people at Orange know my phone number or my email number or my email, and that's totally fine. People do it, and I'm happy to get. And so it's Tom_Belhorn, at med.unc.edu. And I'm always happy to help with answering questions or so, or you know where to find me, or my wife.
Right. Well, thank you both so much for taking the time today to be able to offer such wonderful information. I can't thank you enough, really, for what it is that both of you are doing. And may you continue to have God's hand upon you, guiding and directing everything in the midst of all this. And I know that everyone that has a chance to watch this is going to receive some special blessing out of it. So thank you so much for being a part of this.
Thank you so much for inviting me to be a part of it.
Absolutely. Pastor Corey, any closing words?
Thank you for what you're doing, and we are praying for you, and I hope that anyone who watches this will continue to lift you both up, and all those who are continuing to do this work.
Absolutely. Well, thank you so much for watching. Thank you all for being a part of it. And next week, we'll be back with another edition of Table Talks. Thanks. Bye-bye.